So hello, and welcome to another Physician Spotlight. I'm very excited to be speaking today with Dr. Ezra Steiger here. Dr. Steiger is a professor emeritus of surgery at the Cleveland Clinic. He also serves as a consultant within the Digestive Disease and Surgery Institute, also at the Cleveland Clinic in Cleveland, Ohio. So Dr. Steiger, thank you so much for joining us today.
Oh, it's my pleasure. Thank you. Glad to be here.
And it's very exciting to be doing one of these interviews in person because, so many of these actually have been through Zoom if you guys have been watching this series. So really enjoyable to be here at ASPEN.
Yes, this is terrific. Finally, after 2 years,
Absolutely.
we're live.
Yeah.
Right.
And this year, actually, you have the honor of being awarded a Lifetime Achievement Award.
Yes, it was a huge award and very much appreciated. And accepted it on behalf of my team. Because of their efforts, that's why I won.
Right, absolutely. And I think you're such an inspiration to so many people here in the nutrition space. And I'd love to dive a little deeper. So many of the people that I meet, have been steeped in nutrition for such a long period of time. And I'd love to go back to the beginning and sort of hear how you thought nutrition was going to be a part of your career and that evolution over time.
Well, it didn't really start until I was an intern hospital at the University of Pennsylvania. And when I was an intern there, Dr. Rhoads was the chief of surgery. Stanley Dudrick was the chief resident in general surgery. And I was an intern, and the whole field was just beginning to blossom at the time of my internship. And that whetted my appetite to see how excited they were and how interesting it was to be able to take care of patients who couldn't eat for long periods of time. So that's how I got involved with it. I didn't realize at the time how much I would be involved with it, but it's turned out to be a wonderful career.
Right. And I'd love to hear more a little bit about, I know you worked in some of the laboratories there while you were at the University of Pennsylvania and really were one of the groundbreaking people in developing some of these nutritional interventions.
I did work in the Harrison Department of Surgical Research during my residency years. And as part of that, I did some of the work related to testing crystalline amino acids in beagle puppies to show that it was safe. And that's when we switched from protein hydrolysate use to crystalline amino acids. Also developed an intravenously fed rat model that allowed me to gain insight into the effects of intravenous feeding on liver morphology, liver function, tumor growth, and a host of other things.
Right, and obviously a lot of that has become the foundation of what we know about parenteral nutrition. And I don't know if you have any fun memories from that time when you were working in the lab there that you wanted to share with the people today.
I have a lot of fond memories, not only at the time of the lab, but also my internship and residency. But the laboratory was particularly nice because I didn't have to put in 24-hour days. I was able to go home. And I was able to work with Vars, who was one of the legends in parenteral nutrition. Harry actually started feeding dogs intravenously in the late 1940s, 1950s. And that started his involvement with parenteral nutrition. But he helped me set up an intravenous rat lab. He would not help you unless he saw that you were making a valiant effort and not succeeding. And then he would look over your shoulder and say, why don't you try this? Why don't you try that? In any event, we were successful eventually in setting up that IV rat lab. And as a resident, I was blessed with enough funding to hire a nurse who was in charge of the IV rat lab and a data research person. So there were two people working with me in the rat lab, and we had 20 rats going simultaneously in different experiments. This was during my residency years, so I felt pretty cool about that.
I can imagine. And I can imagine you must be very busy being both surgical resident and, working within a lab.
Yes, and it was a very, very good years. It allowed me to write or co-write a number of papers before I finished my residency. And that was rewarding too.
Absolutely. And what do you think surprised you the most about working in this lab?
I'm not sure that I was surprised. I guess what surprised me was how much of an effort it was to get the model working. It seemed simple enough at first, but there are always little things that made it more difficult, got in the way. One of the things that I clearly remember was when we first started it, these were with bits and pieces of equipment that Dr. Vars had around. The intravenously fed rats would develop a hemorrhagic diathesis. And they would, I couldn't figure out why, and they would die. And then we traced that down to a blunt nose stainless steel needle used in the infusion apparatus that leached copper and caused hemolysis. And that's what led to their death. Until we replaced that with just a plastic blunt nose needle, that's when the whole project started working. So I guess what surprised me was how a little thing like that can interfere with progress in scientific achievements.
Absolutely. And I mean, so much of lab research, I think, is sometimes finding something that you didn't expect and then trying to intervene on that change.
Right. Well, once we solved that problem, everything else seemed to go pretty well.
I guess, absolutely. And I think you've sort of touched upon the importance of mentorship, while you were there in the lab. And of course, you've served as a mentor for so many people in the coming years after you left your training program. I'd love to hear more sort of about the importance of mentorship in your life and how you have transitioned into the mentor and what advice you have for people.
Well, I was mentored by all the surgeons at the hospital of the University of Pennsylvania. When I went on their services, they all had something special to teach me and to help train me. Dr. Rhoads was obviously an overriding influence on all of us, and he was a very important person in the lives of the surgical residents. And there's so many Dr. Rhoads stories that we retell and tell every time we get together. But he was an important mentor, but perhaps more important was Stan Dudrick, who was the person who developed the field. And just watching how hard he worked and how well he got along with people and how much he appreciated everybody's contributions, I think was an important part of my being mentored by him. Just walking in rounds with him and seeing how he interacted with everybody, the people who took care of the keeping the floors clean, the nurses, the dietitians, everybody who worked in the hospital. So everybody was an important person to him, and I learned the importance of treating people nicely from him.
Right, and I think, that sort of speaks to the video that your team made about you yesterday that was so wonderful to hear, and they sort of talk about that personal connection you make with patients, and I mean, what an important thing to pass on to people. And, I'd love to hear about, I don't know if you have any interesting patient stories or something you'd love to share with the people that are listening today.
Well, they all make fun of me, or they all make fun of me whenever I would go into a patient's room, and if it was someone who was down and out, and often most of them are, I would try to cheer them up. And I would cheer them up with doling out pieces of candy. It's one of the things, as well as to the team. And also to make cute little comments like, "You're doing pretty good for a 33-year-old guy," when it was actually an 80-year-old person.
Right.
They would laugh and get a big charge out of that. Then when there is somebody else in the room with the patient, usually a spouse, I would ask them, "Is that your girlfriend, or is that your boyfriend? Or better yet, is that your daughter?"
Right.
And they would get a big kick out of that. So I think helping to make people happy was an important part of what I did on rounds, and an important part of what I did with the colleagues that I worked with too. At the beginning of rounds, I handed them candy as well. One of the other attendees would hand them candy at the end of rounds if they did a good job. But I always knew they were going to do a good job, so I gave them the candy at the start of rounds.
So it's like positive, not even reinforcement, it was just motivation.
Motivation.
And you've been at the Cleveland Clinic for a while now.
Forever, yes.
And
I started August 25th, 1975.
So a few years now.
A few years.
A few years. And obviously the team has probably changed from when you started in the 1970s to now. And what has that transition been like?
Well, the team has grown. I mean, at first it was just me and a nurse who were the nutrition support team. We had some help from dietitians, but they weren't part of the team. Help from pharmacists, but they weren't part of the team. And help from psychiatrists, because our patients were often depressed and had a lot of different types of problems besides their illness. But as the years went by, we increased the numbers of people involved in the team to the point now where there are over 30 full-time members of the nutrition support team. Most of them dietitians, but a lot of nurses and pharmacists who liaise with the team.
Right, and it sounds like, we've heard so much at ASPEN about those multidisciplinary models and the importance in patient care.
Very important. Everyone brings their own area of expertise. They all teach me, I teach them, and everybody teaches each other. So we all learn from each other, and we all learn from our patients too. So it is multidisciplinary in the disciplines, but the patient is one of those disciplines too.
Right. And, the physician role too is something that we talk a lot about in these physician spotlight interviews because, there is this conception that less physicians are being involved in sort of the nutrition space. And I don't know if you have any thoughts about that in any ways we can try to reinvigorate our doctors to be more involved.
Yes, it is of concern that there are less physicians involved, but the field has been changing. When I first got involved, it was mostly surgeons who were involved. Then gastroenterologists and dietitians are taking up an increasing role, not only as part of the team, but as running the team, running parts of the team too. And physician assistants or dietitians who became physician assistants are increasingly involved as primary members of the team. So there may not be as many physicians in the future, but there will be other people taking over their roles. But physicians will always be an important part. And we still need to concentrate on making sure we get physicians as leading members of the team.
Absolutely, definitely physician education efforts and ASPEN, of course, has been instrumental, I think, in those purposes.
ASPEN's very important industry has played an important role too in sponsoring fellowships for physicians to get involved in nutrition support. So a combination of ASPEN and industry, I think, are beginning to show some results.
And in terms of ASPEN and its involvement in your career development, how did you use the organization to move your career?
Well, I've been involved with ASPEN from the very beginnings in Chicago when we first got together to start the organization. And it's been very important, again, as a means of sharing information with my colleagues around the country and eventually around the world. And just taking leadership positions and helping to move the organization as far as public policy issues, I think has helped me and helped other physicians and clinicians involved with the nutrition support area. And I wound up assuming leadership positions in ASPEN, and that has been helpful to me in terms of what I can bring back to my institution, not only from ASPEN, but also by being able to visit other ASPEN chapters and other ASPEN groups around the world, as well as around the country.
Right, so I guess that connection both domestically and internationally.
Yeah, it's been very, very good. And advancing my career and advancing my ability to help others advance their careers.
Well, I think we're running out of time on this physician spotlight. I'd love to hear if there's anything else you wanted to add for the listeners of this podcast and this interview.
No, not really. ASPEN's a great organization. I've been a very proud member of it and a very proud supporter. The ASPEN Rhoads Research Foundation is something that's dear to me because of the connection with Dr. Rhoads. And I think it's an important part of everybody's obligation in the field to support that, to advance the research efforts by supporting the ASPEN Rhoads Research Foundation.
Absolutely. Well, thank you so much for spending some time with us today.
You're welcome.
This was another Physician Spotlight interview, and we look forward to seeing you again next month.
Thank you.